Hello! We are glad to present you our video about popliteal fossa. The popliteal fossa is a rhomboid-shaped space behind the knee joint containing major blood vessels and nerves passing between the thigh and the lower leg. An eminence is along the middle of the region, which corresponds to the adipose tissue of the fossa. It has a roof, a floor, and 4 walls. The walls of the popliteal fossa are from above. Medially, it's semimembranosus, and more superficially, the semitendinosus muscles. Laterally, it's biceps femoris. From below, medially, it's medial head of gastrocnemius, and laterally, it's the lateral head of gastrocnemius, and deeper there, plantaris muscle. The fossa floor is formed by the popliteal muscle covered by its fascia, deeper the oblique popliteal ligament, knee joint capsule, and femur. The roof is formed by the investing layer of popliteal fascia. The skin is very thin, elastic, has horizontal folds, the lower one corresponds to the line of the knee joint, and has sebaceous and sweat glands, and weakly expressed hair. It's innervated by the posterior cutaneous nerve of thigh and the saphenous nerve. Subcutaneous tissue expressed in the center has skin branches of nerves and could have great saphenous vein or its tributaries. Superficial fascia has no features, could contain the small saphenous vein and the skin branches of nerves.
In the posterior, the lateral fascia related into the popliteal fascia and passes into the fascia of the lower leg, having superficial and deep layer. The tendon binding the fossa from above are located in the sheath of the posterior bed of the thigh. The semitendinosus, semimembranosus, and long head of biceps femoris are ganetes together from ischial tuberosity. The short head of biceps femoris are ganetes from the lateral lip of linea aspera. Semimembranosus attached medial condyle of tibia. Semitendinosus attached tibial tuberosity. Biceps femoris to head of the fibula. All are innervated by tibial and sciatic nerve, supplied by profunda femoris and popliteal artery. The tendon binding the fossa from below are located in the superficial layer sheath of posterior bed of the lower leg. Head of the gastrocnemius are ganetes from the lateral and medial femoris condyle, attached to calcaneus, innervated by tibial nerve supplied by the popliteal artery. Plantaris are ganetes from the lateral supracondyle linear of the femurs, attached to calcaneus, innervated by tibial nerve, supplied by popliteal artery. The popliteal are ganetes from the lateral epicondyle from femurs and attached to the medial surface of the tibia. In the lower of the fossa is the Burghoff canal, which formed by the culliva of the popliteal fascia and contains the small saphenous vein.
The main neurovascular bundle from the deeps to the surface, from medial to lateral in upper part, popliteal artery, popliteal vein, tibial nerve. In the lower part, relative relationship of this structure change from medial to lateral, nerve, vein, artery. More superficial and lateral from all, located common perioral nerve. The popliteal artery is continuation of femoral artery, gives a number of branches in fossa. Muscular is sural arteries, cutaneous and 5 genicular branches, superior and inferior lateral and medial genicular arteries and medial genicular artery. Within the popliteal fossa, an arterial anastomosis is visible between the descending branch of the lateral circumflex femoral artery with the superior lateral genicular artery. Also, outside the popliteal fossa, the branches of the popliteal artery anastomosing with other arteries, the genicular articular, the patella, the perimeniscal, the infrapatellar fatty body networks. The popliteal vein ascends through the popliteal fossa to aperture in the adductor magnus, where it becomes femoral vein. Then we have the tibial nerve. Is one of two main terminal branches of sciatic nerve, descends through the popliteal fossa, giving off branches. Muscular cutaneous, which is the medial cutaneous nerve of the calf, articular, The rest of the branches branch off outside the popliteal fossa. The common perional nerve arises from the sciatic nerve originating near the upper angle of popliteal fossa. In the fossa, it's positioned medially to the tendon of biceps femoris muscle and laterally to the gastrocnemius muscle. The common perional nerve giving off branches, muscular, cutaneous, which is the lateral cutaneous nerve of the calf, and articular. Finally, this nerve divides into superficial and deep femoral nerves. Lastly, we have the popliteal lymph nodes, divided into three groups: deep, medial, and superficial.
Pus from the popliteal fossa can spread in some directions. Along the course of the paraneural tissue of tibial and common fibular nerves, or sciatic nerve, to the posterior bed of the thigh, potentially reaching the gluteal region and small pelvis. Along the course of the femoral vessels to the hiatus adductoris, into the adductor canal, the anterior and medial bed of the thigh, then up to the femoral triangle, from where it can also spread along the course of the vessels to the infraperitoneal floor of the pelvis and the gluteal region. Along the tibial nerve, popliteal artery, and the accompanying vein, under the tendon arch of the soleus muscle into the crura popliteal canal, it is into the posterior fascial bed of the shin. From there, it's possible to spread along the tendons of the deep flexors of the shin, posterior tibial vessels, and tibial nerve through the malleolar canal to the plantar surface of the foot. Along the paravascular tissue of anterior tibial artery into the anterior fascial bed of the shin, passing through the hole in the interosseous membrane. Along the common peroneal nerve and the small saphenous vein into the external fascial compartment of the shin. Also, the spread of the purine process is possible in the posterior sections of the knee joint, along the paravascular cellular spaces of the branches of the popliteal artery, to the synovial bursa of the posterior surface of the joint.
Thank you for your attention.